another episode of Going All In, Get the Edge You Need to Succeed. I'm Dr. Erin McKinley, and today we have another awesome spotlight session with Dr. Darla O'Dwyer from the Stephen F. Austin University Combined Dietetic Internship and Masters of Science program based in Nacogdoches, Texas. All right, welcome, Darla. To get us started for this episode, give us a little introduction to you, your journey to RD, and how you landed in your position currently.
Well, I have been at Stephen F. Austin State University since 2003. I really enjoy it here. I started in dietetics many years ago. My first job that I got right out of the internship was working in pediatrics, in particular the NICU and the pediatric intensive care unit. I did that for 6 years, and then after I earned my doctorate at Texas Tech University, I was hired here at Stephen F. Austin. And I was DPD director for the first part of all those years that I've been here. And then I've been DI director for the last almost 6 years. And what got me interested in dietetics is my mother. She was always very health-minded, and we grew up eating all kinds of health foods, and our friends would make fun of us. She would cook tofu and scrambled eggs, and everything was whole wheat. We even owned a goat, and she milked the goat. And so she was very interested in nutrition, and that kind of formed my opinions about nutrition. And then it was just wonderful to know that I could actually get a degree and work in the field of nutrition. And that's what started my journey into dietetics.
All right, and you have one of your interns with us for this episode. Anessa, introduce yourself to us.
Hi, everybody. My name's Anessa, and I'm a current intern at SFA. I did my undergrad here at SFA, and not only did I fall in love with the forest and all the trees and the green, I fell in love with the program and just how caring all of the professors were in my undergrad, and how caring Dr. O'Dwyer seemed to care about her students, care about not just what her program looked like, but actually care about the success of her students. So that's why I chose to come here. I got interested in dietetics. I thought I wanted to be a doctor. And so I got a job in a hospital, and I quickly realized that this is not what I wanted to do. So I was looking around and realized that I felt like I could help people in an even better way in the field of nutrition.
All right. Well, thank you for being here. And Darla, I'll let you take it away with a presentation about your program.
Okay. Well, Stephen F. Austin State University isn't located in Austin, Texas. A lot of people think that, but it's actually located in East Texas, in between Dallas and Houston. It's in Nacogdoches, which is about 30,000 people. So I would say it's a 2-hour drive south if you want to go to Intercontinental in Houston. It's a 3-hour drive north from Dallas. It's a beautiful area, like Anessa said, lots of pine trees. The campus is really beautiful. And I know that everyone listening to this is trying to decide what internship should I apply to. And we feel like SFA is a great internship, and I'll explain some of our unique qualities. Our internship is combined with a master's program, and that makes us a little bit different. We have an enrollment of 10 students every year. Our supervised practice component starts in summer 2. And then students will actually take their first graduate class in summer 2 as well. Then the supervised practice continues through fall and spring, and it ends in late May. We typically don't follow the university calendar, but since ASIN reduced the hours from 1,200 to 1,000, we have spring break now, which is really nice. We have a time frame of about 10 months, and students really like this because they can start the program in the summer typically in July, and then they can finish their rotations in May. Then they can get their verification statement, and then they can get a job while they're finishing the rest of the graduate program. And that's very helpful, especially in terms of finances. They complete one course in the summer when they start supervised practice, and then while they are in supervised practice, they will complete 9 hours in the fall, and they will complete 9 hours in the spring of graduate coursework. After they receive 24 hours of graduate credit, they will receive the verification statement, and then they can finish the master's portion of the program online. So they can leave Nacogdoches if they want, and they can go as slow as they want or as quickly as they want, but they can finish the program within 1.5 years. And this is what the schedule looks like. On Mondays, the students will typically be in Nacogdoches going to class, and they'll take, for example, seminar, and then they'll take Integrative and Functional Nutrition 1. And then this spring, they'll continue with seminar and take Integrative and Functional Nutrition 2. So we'll go over the coursework in a minute. Tuesdays through Friday, they will be in rotations, and the rotations are typically 32 hours a week, and we have 37 total weeks that they are in rotation, which spans, again, the late summer all the way till late May and June. Interns are in the hospital. So I've got a list here. We've got acute care hospitals, and I've got the weeks listed of how long they are typically in acute care hospitals or diabetes outpatient, dialysis centers. They do rotations at Extension, WIC administration, WIC clinics, food service management, both hospital and school food service. And then another thing that's kind of unique about our program is they have about 5 weeks to choose electives. And we have various electives that range from cystic fibrosis clinics, bariatric clinics. They can go to HEB, which I know Anessa really loved, and Market Street. We have East Texas Food Bank, community-supported agriculture, Head Start, and other opportunities. And some of them come and go as we have sites available. Isn't this a beautiful picture? So colorful. This is what the students receive when they start their supervised practice, and this is kind of what their schedule looks like. And as you can see, everybody's doing different things. And for example, we'll look at student 1. They start at WIC clinic, and then they'll have 2 weeks at WIC administration, and they go back to WIC clinic, and then they'll have an elective. Then they'll go to school food service, bariatric clinic, extension, dialysis, diabetes outpatient, and then the spring semester, the student would be in 4 weeks of food service management and 11 weeks at a hospital clinical rotation, and they would have various electives. So everybody's kind of doing their own thing, and this is just an example. You're not at one place, and that can be an advantage or a disadvantage depending upon how you look at it, but you're going from place to place, and sometimes that's good because then you get different experiences. Whereas I know some programs, you're at one facility and you stay there the whole time. That can be advantageous because you're not having to constantly meet new people and learn how to navigate all of the different personalities. On the other hand, you are getting to go to different places and see how different places function. Most of our rotations are located in the East Texas area. Some electives are in Houston. For example, HEB is in Houston and Market Street is in Dallas, and those are electives. For our required sites, though, they are located in East Texas, and this is new for this year. We have 2 D&D digital sites that students can apply to. And they can apply to either the Tyler Longview area or the Nacogdoches Lufkin area. And it's about split half and half. So we take 10 students. We can take 5 for the Nacogdoches area and 5 for the Tyler area. This is what our graduate course rotation looks like. Like I said, in the summer, they'll be taking their first summer course, and this course will prepare them for the internship, and we test them over DPD knowledge, and then we get all of the legal issues ready for them to enter the hospital setting. And then in the fall, what's really cool about our program is the students get 4 credit hours in the fall and 4 credit hours in the spring of graduate coursework to go through supervised practice. So that's 8 credit hours that they receive of graduate level coursework to be in supervised practice. Now, along with that is some academic work. So they don't get to just attend rotations and do nothing, but attend rotations. They have to complete pretty extensive case studies, but it allows them to apply what they're learning in rotations to cases and really extensively review a patient's history and assessment, diagnosis, intervention, monitoring, and evaluation. Then that work is then presented to the other students in seminars so everyone can learn from each other. In addition to the supervised practice practicum course and seminar, the students will be taking a course in Integrative and Functional Nutrition 1 in the fall, and then they will move to Integrative and Functional Nutrition 2 in the spring. So they get a really in-depth study of all things related to Integrative and Functional Nutrition. And I'll tell you a little bit more about that, and Anessa can tell you what she's been learning as well. And I wanted to tell you, this is what our spring schedule looks like, very similar, just the second half of Integrative and Functional Nutrition. Students, because half may be in Tyler and the other half are in Nacogdoches, these classes are what we call a high flex class. They're offered online, so students can stay at home and they are live streamed Zoom. So kind of like what we're doing now. They can view seminar, they can be in Integrative and Functional Nutrition and Zoom from their home and not have to drive the 90 minutes to get to Nacogdoches to attend class. It seems like since we started this, probably 70% of the students attend class at various times, and it could differ based on weather and whether somebody might be having to quarantine or maybe they just don't feel like getting out. So I think it's great for them that they have that choice. Okay, in the summer, right at the end, they'll finish their supervised practice and then they'll be taking public health nutrition, and we have some ASIN competencies in this course. This is a 4-week course and it finishes in early June. And once they finish this course, so they've accrued after completing this course 24 hours of graduate credit, they will get their verification statement issued. And then they can finish variable electives to fulfill the rest of the 36 hours. And the fall research methods is required for them. Everything else will be electives at that point. And then we have, as part of the master's program, we are required to have a comprehensive exam component. And this is new for this year, but the students are going to be doing an e-portfolio where they gather their information, choose their case studies to put in this e-portfolio, have a PowerPoint presentation, they write a scientific blog, they do a grant proposal, an IRB proposal, and then they can put their work samples in this e-portfolio, and then they present that, and that is their whole comprehensive exam over all of their graduate and supervised practice coursework. And the idea is for them to use this and send it. They're going to publish this on a website, and they can use the link and give it to employers so that the employers can see all the work that they've been doing. So I think that's pretty cool. So what's unique about our program is we don't have an application fee. There is a $50 application fee to the graduate program, but no application fee to the supervised practice itself. The graduate credits are full-time, which allows the students to apply for financial aid. They can sit for the exam within 10 months and go ahead and get a job. And then they complete the rest of the program online. And I've been DI director almost 6 years, and there hasn't been a student yet that has not completed the MS program. In the past, there have been some, but most finish. There's a few that might want to take it slower than the others, but 95% finish in 1.5 years. So this is just about our focus in integrative and functional nutrition. If you look at our focus for the supervised practice, it's community, because we are in a rural area and the internship provides quite a few community rotations related to community. But the graduate program is focused on integrative and functional nutrition, and we try to incorporate what they're learning in the graduate program to what they're doing in supervised practice, although sometimes it's kind of hard to apply integrative and functional concepts to, for example, the acute care setting. But what integrative and functional nutrition is basically just learning to treat the whole person rather than a set of systems. And the intern learns about not only diet, but lifestyle factors, gut health, genetics. And this is just some of the feedback that students have given us over the years. Learning about integrative and functional nutrition has completely changed how I think about nutrition. I work as a registered dietitian in obesity prevention and treatment. I firmly believe that my education in integrative nutrition from SFA allows me to treat my patients holistically and provide them with care that is uniquely suited for them. And those are pictures of my fermentation jars. And I really enjoy fermenting. I definitely have to practice what I preach because I got into this integrative and functional area due to my own health problems. I had severe irritable bowel syndrome after I had my second child, and conventional dietetics wasn't really helping me resolve my symptoms. So I kind of had to look outside of that, I guess, mindset and really investigate what is the cause of my symptoms. And FODMAPs was not helping me, so I had to look outside of the FODMAPs diet and really look outside of what was currently considered the norm, and it really changed my life. And I felt empowered after looking outside of what was offered in the textbooks, let's say. And I'm not saying there's no evidence for this. There's tons of evidence. And that's what I teach the students, is to look for the evidence. It's there. A lot of evidence is there. It's just we haven't been taught to look for it. So that's why we have this focus, is because I feel like it empowers students to do more for their patients and themselves. Our schedule is unique because we have about 5 weeks of electives, and students really like that diversity. And they, of course, like that they can finish in a year and get their verification statement. And in a previous slide, I said 10 months. It used to be 10 months, but now it's changed due to the requirements of that community nutrition or public health class, because we have a competency in there and they have to get through that public health class. So in June, they start in June, they end in June. Our admission requirements, we do not require a GRE. Isn't that awesome? We have about 35 to 40 applicants a year for 10 spots. Standard DICUS application, minimum GPA 3.2. We have a DPD GPA of 3.4. Reason why we have minimum and GPA and DPD GPA is because we feel that students really need to have established their study skills because this is a combined program. And Anessa can speak more to this, but I would say it's a very, what we would call acute. I mean, the students are working almost full-time and attending full-time graduate school, and there's no time to develop study skills. They already have to have them, and it's important that they have already learned that, and that's why we have somewhat emphasis on the GPA. However, we do not exclude somebody from applying to the program if their GPA doesn't meet the minimum. And we try to look at their application from a holistic viewpoint. Maybe somebody didn't do too well in their freshman and sophomore year, or maybe they had to work really hard while they were going through their program, or maybe something happened and they had a semester where they just didn't do as well. So we still will look at the overall application. We don't have any formal interviews, and we really like to look at personal statements. I know you're going to ask us some questions, Erin, about resumes and things like that. But so we try to take a really holistic viewpoint of the applicant. Okay, Anessa, what do you have to add?
So I chose SFA, like I said before, I knew about it because I did my undergrad here, and I really felt that I could be well supported in this environment. I felt like I could learn well in this environment. And not only did I feel like I could learn well, I felt like the integrative and functional nutrition is what I wanted to learn. And so just being able to learn, it's so much information, but being able to learn it from such a passionate professor makes it so much more special. And I can't wait until I have better grasp on all the information that we're learning right now. So a week in my life, on Mondays, I go to the seminar in the integrative class. And so that lasts from 9 o'clock to 12:30 in the afternoon. And then lately, some of the other interns and I have been getting together, and we'll go get lunch, we'll hang out after the class. And it's just a really nice way to start the week and talk about what we've been doing, just hang out and kind of bond with these people that are doing the same thing as what we're doing. And then the rest of the week, we are all at our different facilities doing our different rotations. So for instance, this week I'm at diabetes outpatient, and I get to help educate and inform people about diabetes and the risk of diabetes and what can happen. I'm able to participate in a public health fair this week, and so that's really fun to do. I just got lucky with being able to do that. And that's pretty much what my schedule looks like Tuesday through Friday, just doing my rotation, coming home, cooking dinner, trying to get done with my homework so that I can have a little bit of time to relax on the weekend. For managing the rotations with going to school full time, it can get really overwhelming. And so I think it's important to schedule out what you plan to do to make sure that you have time to complete what you need to complete. But I also think it's important to schedule in time to relax so that you don't get burnt out and overwhelmed.
This is my contact information, and we're ready for Erin's questions.
All right, perfect. Thank you for all of that information. And I'm going to jump right into the 5 questions that I ask every program that comes on the podcast. And these were put together with the help of my students. So they're definitely questions that have come from students and not just me. So what is one thing that you just love to see when you're reading an applicant's personal statements?
Well, I like to see it individualized to our program because we do have the focus in integrative and functional nutrition. So it's very important that the applicant wants to come here to learn that. because it is kind of a different focus from what other programs may have. So that's very important. If you want to come here, you need to let us know that you're coming here because you want to learn about that. Another thing is it's very important to let us know, for example, if you don't meet the minimum GPA requirements, let us know why, what happened. Don't gloss over it. I think it's very important to see what happened. Maybe there's some reason. I can say that my freshman and sophomore year, I didn't do as great, and it just took me a couple of years to learn study skills. Let us know that. I had to work really hard. I had 2 jobs through my college education. So things happen. So please put that in your personal statement if you need to.
All right. Well, my second question is a true or false question. So true or false, an applicant's resume should always be 1 page and 1 page only. Either way, why?
That's false with some caveats. We had an applicant a few years ago that had been working in industry for 20 years, and she got really stressed about how to make her resume 1 page because she had so many important experiences and certifications that she wanted to put on there. Well, it shouldn't have to be 1 page. If you have all those experiences and you need to list them, then you might need to go over a page. But if you're more of a traditional student, high school, college, straight into the internship, it's not, you don't need to have more than 1 page. I really don't want to see, and we have a selection committee, so I'll say we don't really like to see what you did in high school or you did an hour of volunteer work at the food bank and all of that's listed on the resume. That's not very necessary. So I guess it depends on how much information you need to put on the resume, and you really need to have information about work experience, certifications, and things like that, and not necessarily what happened in high school or some of the community services that you just volunteered for that were a short time span.
All right, perfect. Well, my next question is, what is one thing that an applicant may do? And this could be in the application itself or maybe in any interaction that you might have with them prior to them applying. But what is one thing in particular they may do that either raises a red flag or you just maybe say to yourself, I don't think this person's a good fit for our program?
One thing that they might do to raise a red flag is to use a family or personal friend or even clergy as a reference. We feel it's important that the references should be professional and not family or close friends. And preferably the reference needs to know you really well so they can speak to your characteristics. I guess I could say another thing too is on the personal statement, just make sure it's grammatically correct. Please. It's very important.
All right. So what is one area that you're working on trying to make even better of an experience for the interns?
We are actively trying to get more integrative and functional nutrition sites. We have a really cool site. I'm hoping we're starting the contract process, and it's with a well-known functional medicine practitioner that practices online, as a big online and brick and mortar practice. And we're working on that, and it would just be nice to have more online sites because in our area, it's hard to find integrative and functional nutrition practices that students can actually go to and practice what they're learning in class, except for in case study application. So that's what we're trying to do, is find more sites that students maybe can just work with the preceptor online.
The 3 adjectives to describe applicants.
Yeah, I thought about it. I mean, they really have to be good at handling stress and confident and they need to be respectfully assertive. And that term was coined by an intern that we had last year, and that is so important to be respectfully assertive. So ability to handle stress, respectfully assertive, and confident.
All right, I'm going to throw it to Anessa. What are some adjectives that you feel maybe describes yourself or maybe some of your fellow interns in your class currently?
I think we're all very open-minded and willing to learn this information that's kind of not popular at the moment. I think that we're all
so great you just can't think of anything.
Yeah, we're all just, we're fantastic.
Well, the open-minded part is so important, and I'm glad you brought that up, because not that we're teaching things that aren't evidence-based, but it's just
not popular.
I think it's becoming more popular, but among dietitians, I don't think we've caught up yet.
Yeah, definitely. And I think it's important that we do catch up.
I think it's the future of medicine, future of nutrition. So what other adjectives do you think? Hardworking.
Yeah.
Perseverance.
Yeah, definitely. I think we're all really caring as well. We're in this program because we care about other people and we care about the health of other people. And we want to do everything we can to improve upon that. And I think that we're all, I don't know how to say this in just one or two words, but we want to better the health of not just us, but the nation. We want to include diversity in our practice. We want to figure out ways to improve the health of everybody.
So what type of exam review do you do with the interns, or how do you integrate an exam review into the program, and how has that affected the pass rate for the program?
In the spring, and this happened a couple of years ago, we implemented Eat Right Prep. And then in the class, we will practice. So we start that in the spring. So we'll start practicing going over questions. And actually, the students, when they're presenting their case studies and seminar, I ask them that they also have the Inman review. So I ask them to go through the Inman review and pick questions related to the case. And then we go over those questions. So every time a student presents their clinical case study, we review the 5 questions, and we actually break the question down and the answers. Why is the answer wrong? What makes that answer right? What are some clues in the question that could help direct you to the answer? So we really work hard on trying to go over dissecting questions and answers. And then in the spring, we have the Eat Right Prep, and we'll try to, again, keep going over questions.
How has the program's pass rate been the last few years?
It's been great. When the 2017 standards came out, we had a dip in first-time pass rate, but our overall pass rate over the year is excellent, over 90%.
All right, perfect. So I know that, like many other programs in the U.S., around this time last year, or March of last year, there were a lot of last-minute changes that had to be made to programs to kind of work around everything with COVID. Have you done anything to temporarily change the program to kind of fit what you're able to do with COVID-19 restrictions that you actually like and that you want to keep as an element of the program?
Yes, well, I love going from 1,200 hours to 1,000. Really like that. And then I've included alternate experiences. For example, this year, typically they go through 2 weeks of dialysis, and they weren't allowed to be in the dialysis clinic due to COVID. And they have 64 hours of alternate experience, a module that they do with case study assignments, and they can meet online with the dialysis dietitian. So they do the case studies, they go through all the reading and videos, and then at the end of that 2 weeks, they meet with the dialysis dietitian and ask questions. And I think that's very helpful. Of course, I'd rather them be in dialysis, but I feel like we've worked hard to make the best of the situation. And I have created other alternate experiences that will stay. For example, they go through 32 hours of nutrition support before they start their clinical rotation, and that really helps prepare them for their clinical rotation. I see Anessa's shaking her head. Did you like that module, Anessa?
I did. It was very helpful, a good refresher.
All right. Well, that's all the questions that I have. So to close out this episode, I would love for each of you to just give one last take-home message to potential applicants.
I would say a take-home message to potential applicants is to just try to relax as you're going through this process and understand. I get a lot of students saying, I don't know what I want to do. I don't know what I want to be. Well, don't worry about it. Just get your RD, and then there's so many opportunities that you can specialize in once you have your RD. That's what I would say, is just try to relax while you're going through the process and while you're going in the internship, and don't worry, oh my gosh, I want to be in diabetes outpatient, or I want to do this or that. Just enjoy the experience. And then when you finish and pass the test, then you can specialize later on. And those specialties may change as the years go by.
Yeah, my take-home message, just in addition to that, just be confident in yourself and be confident that you'll be in the right place that you're supposed to be. And that even though it's going to get hard, it's going to be worth it once you get on the other side.
All right. Thank you both so much for being with me for this episode. And for those at home who want more information on the Combine program at Stephen F. Austin, I provided the website link in the description below this video. And as always, don't forget to like this video and subscribe so you never miss an episode with another awesome dietetic internship. And we'll see you next time. Bye.